When you're in your final year of medical school, you're probably going to start to be wondering what it's going to be like working as a doctor. Now here in the UK, you apply to what's known as the Foundation Training Programme. And this Foundation Training Programme basically gives you the location you're going to be working in, the hospitals you're going to be working in, the different specialties you're going to be working in throughout the 2 years, and kind of gears you up towards working as a doctor for the rest of your career. Now this can be a daunting experience for anyone, especially if you don't know what's expected of you working as a foundation doctor and what the Foundation Programme actually entails. Hi, my name's Colin and I'm a junior doctor working in the UK. Now in this video I'm going to be talking about what the Foundation Programme actually is, what's involved as you go through the Foundation Training Programme, and what's expected of you to complete the Foundation Training Programme at the end of the 2 years. So, what is the Foundation Training Programme? Well, the Foundation Training Programme is a period of 2 years of training that takes place after you graduate from medical school. And it's split up into two components, your FY1 year and your FY2 year. Now, in your FY1 year, you basically hold provisional registration, you don't hold full registration. And that's because there's an expectation that you'll receive some supervision during your initial period of training. Now, during your FY1 year, there's an expectation that you're going to meet the curriculum needs of the Foundation Training Programme. And by that I mean you'll basically be doing some clinical skills such as cannulas, catheters and all these sorts of things, and you'll get them signed off throughout the year. You'll also be expected to keep a portfolio of reflections of your time in training as well as part of your FY1 year. At the end of the year, you'll have this portfolio and these competencies assessed by a panel, and if you meet the requirements of the panel, that's what will allow you to pass on to your FY2 year. So essentially, if you meet the requirements, you'll then move on to your FY2 year. Now the Foundation Training Programme is split up into 2 years, as I just said. The first year is split up into 3 specialty rotations. Usually one of them includes general medicine and a surgical specialty as well. The following year, in your FY2 year, you'll also have 3 rotations, and these could be anything. Usually over the 2 years you'll have at least 1 community placement as well. Broadly speaking, the purpose of the Foundation Training Programme is to provide new doctors with an education in the generic skills required to then go on to apply to specialty training. However, this is up for debate. Basically, the current situation is more and more doctors are taking time out of training after completing the Foundation Training Programme and taking what's known as an F3 year, and I'll link a video up here as well, one of my previous videos which discusses what an F3 year actually is. Now because more doctors are taking time out of training, there is some debate as to whether the Foundation Training Programme is actually providing them with what's needed to apply to specialty training. However, whether this is true is up for debate, as more and more doctors are choosing to take time out of training to gain other skills before then going on to applying to specialty training, which suggests the Foundation Programme isn't actually giving them what they need. So, what does working as a foundation doctor actually involve? Well, we'll use general medicine as an example. So, say you're an FY1 doctor who's attached to your general medicine specialty, part of your 4 months of training in that specialty. Well, you'll usually start the day by taking part in a ward round, and this will usually be carried out by either a consultant or a registrar, so a middle grade doctor. And basically, you'll be expected to usually be taking the notes for the consultant. So you'll follow them around as they see the patients, do their assessment and come up with a plan for each patient. Now there may be times as an FY1 where you're expected to do a ward round on your own. This really shouldn't be happening too often, but given pressures and things, more and more doctors are being pushed into the situation. And when you're doing a ward round on your own, you're again going to be doing the same sort of thing. So you'll be assessing the patient, documenting your notes and coming up with a plan for their management. Once the consultant or the registrars come up with their plan, after the ward round's over, you'll then have a list of jobs, and these jobs will include things like taking bloods, making specialty referrals, recannulating patients, putting a catheter in, these sorts of things, or discharging these patients home once they're medically fit to go home. And that's basically the sort of typical day-to-day stuff that you'll be expected to do on most specialty ward rounds, even if it is general surgery or orthopedics or wherever you're working in. There's a sort of expectation that most of the jobs are quite generic. However, if a patient were to become unwell in the ward and your consultant and registrar, they might have left the ward at this point, you'll be the person that's expected to go and see the patient first, make an assessment, and then seek senior advice. Now, as part of your rota, you'll also be expected to do on-call shifts. Now, these on-call shifts vary, so you might be expected to be doing evening work, night shifts, or weekend long days on call. What this will involve is seeing any patients who need urgent treatment or changes in their management, and you may be expected to do some things like bloods and prescribe some fluids and things like that. However, it's more of a sort of, you only see patients when you need to see them. It's not like you're going to be doing a daily ward round with these patients, especially in the evenings or weekend long days on call, or nights for that matter. Now, as part of this role as well, there may be an expectation for you to carry the cardiac arrest bleep. Now, don't worry, you're not going to be the only one carrying this bleep. There'll be senior doctors, anaesthetists and all the rest of it carrying these bleeps as well, but you will be expected to attend any peri arrests or cardiac arrests, and often your role as FY1 is to be either taking bloods, or in a cardiac arrest situation you might be expected to do chest compressions as well. But you will see, it's working as part of a team, the other senior members, what their role is, and obviously they will likely have had more advanced training than you. As an FY1 you typically do your advanced life support training at some point during the year as well. So I started in August, and I didn't do my ALS until May the following year, which is a bit annoying because I'd already had my medical rotation at that point when I was carrying the arrest bleep, so it would have been useful to have that as well. The other type of shift you can have in medicine whilst working on call is to cover the medical admissions unit. So basically this is where new patients are coming in through A&E and they're going to be admitted to a medical ward. There's an expectation that you'll go around seeing the patients, taking a patient history, coming up with an initial plan for them. So it might be things like taking bloods, prescribing some antibiotics, giving them fluids, and then once you've done all that, there's a consultant that'll come around and do what's called a post-take ward round. The post-take ward round is basically when the consultant reviews the patient after you've done it, and they come up with their own plan, and often it may be quite different or more extensive than your original basic plan, and that's fine because it's expected you're an FY1. Once they come up with their management plan, there's an expectation that you'll then go back and enact on that. So that may be referring to another specialty, it may be doing specific blood tests, it might be writing up certain medications, and that's fine. That's basically your role as an on-call medical admissions unit FY1 or FY2. Obviously the role of the foundation doctor will vary depending on what specialty you're working in and which hospital you're in as well, because you get bigger hospitals such as tertiary centres and you get district generals, so they may have less or more patients depending where you're working. However, that's kind of a general broad view of what it's like working as a foundation doctor in a generic medical specialty. So what is actually expected of you to get through the foundation training programme? Well, like I said, it's kind of broken into 2 years. You've got your FY1 year and your FY2 year. At the end of each year, you'll have what's called an ARCP, and this is basically a review of your portfolio to making sure you're keeping up with the competencies and meeting the curriculum. And this will be done usually by the head of the year, who's usually a consultant who works in the hospital. And there may be some other members of this panel, so it might be people who are working as part of the postgraduate medical education department within the hospital, and there may be other consultants as well, or some of your supervisors from previous rotations, and they'll basically look through your portfolio and make sure you're meeting the competencies that are required to get through the year. And I'll go through the competencies just now. Some components of the curriculum include completion of 12 months of training, excluding annual leave and up to 20 days of sickness, a satisfactory educational supervisor end of year report, a satisfactory educational supervisor end of replacement reports, you'll have 2 of those, a satisfactory clinical supervisor end of placement report. So every rotation you'll have a consultant who sits down with you, who's been supervising you throughout the rotation, who's basically signed you off after the end of the 4 months. You'll also have satisfactory tab completion. Now, tab is basically when you get feedback from other members of a team you're working with. So basically you send a feedback form to either the nursing staff, the physio staff, other junior doctors, your consultant, registrars, and they'll give you anonymised feedback, which then gets collated together and is part of your portfolio for the end of the year. You also have satisfactory placement supervision group reports, satisfactory completion of all curriculum outcomes. Basically it means you've met the competencies of your portfolio, so that can include things like making sure your clinical skills are up to date with things like catheters, cannulas, taking bloods, these sorts of things. And you'll get them signed off throughout the year. There's also number 8, so satisfactory engagement with the programme. It's basically making sure you do the reflections and have an accurate teaching log. Basically throughout the year you're going to be expected to reflect upon things, and you can basically reflect upon anything as part of your training. So if you've had a particularly challenging day, you might want to reflect upon what happened, what went wrong, what you could do better next time, and that's kind of the sort of idea. Or the opposite of that, you might have had a really good day and you can reflect upon what made that a really good day. There's lots of different reflection theories and frameworks that you can use that are online. Quite often one that's used is Gibbs cycle. You can Google that and it's just basically a way to lay this out. Number 9 as well, so PSA completion as an FY1. So basically PSA completion is essentially you, at the end of your final year of medical school, there's an expectation that you'll do a prescribing exam, and most people typically pass that before they start working as an FY1. However, some people don't, and that's fine, but there is an expectation that you'll have completed it by the time you finish your FY1 training, so you'll have to do it at some point throughout the year. And most postgraduate medical education departments do offer you support if you're doing it as part of your foundation training program. So hopefully you found that useful. I've basically done a sort of broad review of what the foundation training program's actually like, and there's plenty of resources online which go into more detail. The foundation program itself, it can be very variable. It just depends on where you're working, what specialties you're in. You might find like some specialties more than others, or some hospitals more than others, and that's completely normal. But it's basically the first 2 years of your postgraduate medical education, and after that, like I said, there's an expectation that you will go on to do specialty training, although you might take a break before you do apply. Hopefully you found this useful. If you have, please give this video a like and subscribe to my channel. Thanks.